Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Antihistamines blocks the effects of histamine in the body. Once released from mast cell, they won't inhibit the mast cell from producing histamine. They will block the effects of histamine at the receptor level. Histamines are culprits in acute and chronic urticaria, angioedema, acute insect bite reaction, and cutaneous mastocytosis. Hence, antihistamines can be used in treating diseases where histamine is the culprit. Coming to H1 antihistamines. These are most important because H1 receptors are the major histamine receptors present in skin. Almost 85% of histamine receptors in skin are H1 only. They work as inverse agonists of H1 receptors. Inverse means opposite action to that of agonist. Here agonist is histamine. Our antihistamines acts as inverse agonists. There are two generations. First generations are ether-based imidazole ring structure of histamine. They are more lipophilic, hence they will cross blood-brain barrier and cause sedation. They not only block only H1 receptor, they will also block acetylcholine, leading to antimuscarinic side effects like dry eyes, dry mouth, urinary retention, constipation. Because of these side effects, we have created chemically modified derivatives of first generation antihistamines, that are second generation histamines, which are less lipophilic, so less sedating, less anticholinergic side effects because they are highly selective at H1 receptors. They block H1 only, they won't touch acetylcholine receptors. Coming to examples of first gen H1 antihistamines, APE, A for alkylamine, example chlorpheniramine maleate, CPM, injection novel, we must have heard many times, available in tablets, syrup, injection formulation. Piperidine, example cyproheptadine, available in syrup and tablet formulation. Piperagine, example hydroxygyne, available in injection and syrup formulation. Atarax is nothing but hydroxygyne. Phenothiazine, example promethazine, available in injection, tablets and syrup formulation. Last, E for ethanolamine, example diphenhydramine, available in same syrup, injections, tablets, 25 mg, 50 mg, but in addition it is also available in topical formulation. It is present in calamine lotion, which we prescribe for urticaria patients, along with oral antihistamines. Coming to second generation antihistamines, I already told you they are nothing but derivatives of first generation. From alkylamine we will derive acrivastin, from piperidine loratadine, desloratadine. Desloratadine is an active metabolite of loratadine. Next, fexofenadine, rupatadine, ibastine, bilastine, mijolastine. Here I have wrote ketotifen in middle because it is classified under second generation, but like first generation, it has more sedation and more anticholinergic side effects. Cetirizine is derived from hydroxygyne. Levocetirizine is active metabolite of cetirizine. Both are category B drugs, can be given in pregnants. First generation antihistamines are metabolized in liver and excreted unchanged in urine, whereas second generation they are already active metabolites of first generation, so they won't undergo further metabolism, will have less drug to drug interaction when compared with first generation. We will know something about cetirizine. Cetirizine is a carboxylic acid metabolite of hydroxygyne. It is first generation, cetirizine is second generation. Peaks in 1 hour, suppresses histamine induced wheals in 20 to 60 minutes, that is within 1 hour. These effects will last for 24 hours. Peaks in 1 hour, reduces wheel in 1 hour, acts for 1 day. T-half of 8 hours, reaches steady state plasma levels within 3 consecutive days of administration. There will be little to no tolerance after repeated doses. So even after repeating the same dosage, there will be no tolerance, that is reduction in therapeutic response in response to the same repeated dosage. We can continue as it is. No significant hepatic metabolism. So less drug-to-drug interaction. Excreted unchanged in urine also inhibits eosinophilic accumulation in tissues, in skin also. What are safe antihistamines during breastfeeding? Cetirizine and loratadine. H1 antihistamines may be beneficial in atopic dermatitis patients with allergic rhinitis and allergy-induced asthma, as H1 receptors exhibit high degree of plasticity in response to disease and drugs. Plasticity means adaptability. In response to inflammatory disease like atopic dermatitis, H1 receptor expression will be increased in nasal mucosa for allergic rhinitis patients. Hence, H1 antihistamines will also be beneficial in allergic rhinitis patients as it blocks H1 receptors, which got its expression increased in atopic dermatitis patients. Coming to H2 antihistamines, they are mainly inverse agonists at H2 receptors only. They have strong CYP enzyme inhibition, so they will increase the levels of beta blockers, calcium channel blockers. At high concentrations, they have CNS side effects also, like drowsiness, dizziness, headache. Examples for H2 antihistamines are cimetidine, ranitidine, famotidine, nizatidine. We can combine H2 antihistamine along with H1 for added antipruritic effect. Doxepin is a tricyclic antidepressant having a potent H1 and H2 antagonism, both H1 and H2 blocker. It is 800 times more potent than diphenhydramine at the level of H1 receptor. So, more sedation. It will also block acetylcholine, more anticholinergic side effects. Available in oral and topical formulations. Both are contraindicated during lactation because it is a potent inhibitor of H1 receptor. It will cause sedation. We have to avoid doxepin in glaucoma patients and along with monoamine oxidase inhibitors, as it will increase intraocular pressure. Doxepin have to be reserved for intractable pruritus, can be used in psychogenic pruritus, nocturnal pruritus. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.